I am going to go ahead and start recording this. So this will be recorded. You will get this sent out to you. And so everyone in attendance today, you're going to get a copy of this webinar. So no worries about that. We also have some fantastic handouts for you as well that are going to be needed. So we have some great handouts for you as well. So let's first we're going to jump right in and we're going to talk about the legal aspects of groups. Okay, the legal aspects of groups. And so of course we all know about HIPAA, right? We are well versed in HIPAA. We have had HIPAA thrown at us for forever. We're going to talk about gossip, and we're also going to talk about the 21st Century Cures Act. Now, I'm going to throw a poll out there and ask how many of you have heard of information blocking, because I think it's an important thing for us to go over and cover. And so the information blocking, how many of you heard of information blocking? And if you haven't, don't worry. There's no shame in that. It's been out for about a year, but we'll talk about it and we'll go more in depth. Now, the first thing that we're going to go over is confidentiality of patients. Okay, confidentiality of patients. And as the group leader, as most of you, all of you in here are, the in the clinician group, therapy services are kind of bound to the laws of confidentiality, and that's concerning patients, their medical history, their diagnosis, other personal information. Now, here's the trick. You're bound to the law. The other group members aren't bound to the same laws, and they face absolutely no legal consequences for sharing information from the sessions. There may be consequences from your session, like they have to leave the group, right? But there is no legal consequences for that. And as a result, individual patient confidentiality can be difficult to maintain, especially when you start getting into the larger groups where leaders have less control over what information gets shared within the group. So now confidentiality of clients, we know has to be maintained, and you have to have a really firm discussion held about the importance of maintaining that confidentiality within the group, right? So these steps that you see on this slide will help protect you as a clinician if there's ever a breach of confidentiality and health information. So, if you're not doing so, you should really establish some group confidentiality agreements. And we have a sample of this. We put that up as a handout. So, if you're not using that, it's really important to have one of those in place. And attendees of the group should sign these agreements. And as a clinician, it's important to discuss confidentiality with each individual prior to even beginning the group. So, and if you also discuss the confidentiality in a group setting with all members, and that may help put members of the group at ease by reviewing the topic. So it's kind of like two birds, one stone. I'm going to give you a confidentiality agreement. You're going to sign that. I'm going to speak to you about confidentiality prior to us ever getting into this group. And then when we're in the group, I am going to talk about the importance of confidentiality. Again, one, I'm covering myself as a clinician. So I have discussed this multiple times, and it makes people in the group feel more comfortable. So now it's really important too. You only use first names of the group members, and you need to be really clear on when confidentiality ends. So if a release is signed that ends confidentiality, if records are requested, a lot of times people don't understand that. You understand that as a clinician, I understand that, but a lot of times your clients or patients don't understand that. So there's an ending of confidentiality if records are requested and they sign for that. You also need to make clear in group if there's suspected abuse of children or elderly. Confidentiality has ended at that point, right? Or if a client threatens to harm themselves or they want to harm someone else, we can't really keep that confidential, right? There's a duty to warn. And that's what it's called in North Carolina. It's called a duty to warn. So now I'm interested to see what it's called in your state. Do you have a certain terminology that some people use in your state or in your country? Duty duty to warn is here and it protects clinicians. So, but I'm interested to hear if other folks have, let's see, also duty to warn. All right, fantastic. Fantastic. So, so that if you're really clear about when confidentiality ends, that's very helpful to individuals as well and letting them know. So, I always like to get the legal aspects of the groups out of the way before we kind of continue on. So, duty to protect. All right, great. So, we've got a duty to protect, duty to warn. Excellent. All right. So I always think that's really important to let clients know. One, so they don't feel like you betrayed them anyway. No, we talked about this up front. So now we do have that handout on the confidentiality statement. If you're interested in that, it's up in the handout section. Go ahead and grab that. And how many of you use those handouts right now? If you don't, it's okay. You can say no. But if you're using those handouts now, let me know in the chat. And the next thing we're going to go over is going to be the 21st Century Cure Act. Now I'm going to run back to that poll and I want to see how many people. Okay, so I've got 23% have heard of information blocking, 77% have not. And that is okay. There's nothing wrong with that because let me tell you, it's one of those federal laws or mandates, and it is a federal mandate. Um, so it's just as important as like HIPAA when you think about it from that way. So it's this federal mandate, and it wasn't very well, like I don't want to say marketed, but it really wasn't. People just were not aware of that. So let's talk a little bit about it so you know about it so you won't make any mistakes concerning it. So this is the 21st Century Cure Act. And what it really did is it called on the healthcare industry to kind of adopt standardized application programming interfaces, which are called APIs. You're probably familiar with that term, APIs, which help allow individuals to securely and easily access structured electronic health information, like even using smartphone applications to do it. And the act has some really wonderful features. And if we think back on the HIPAA law that came into place, HIPAA had some really good features in it, right? Like it allowed people to keep their health insurance, but there were those privacy laws kind of embedded in it that really represented some issues for healthcare providers. Well, it's kind of similar like that to Cures. Cures has great stuff in it. It has the Cures Act has a $6.3 billion law that provides for accelerated cancer research initiatives. It also provides a lot of money to increase the understanding of the human brain through the Brain Research Advancing Innovative Neurotechnologies Initiative. That is a mouthful, but the acronym for it is BRAIN. So a lot of research funding to help for cancer and to basically map out the brain and study the brain. But also in the Cures Act, there is something called information blocking. And everyone in here, if you're in the United States, this applies to you. So let's talk a little bit about information blocking. Basically, it means that you cannot interfere um, or prevent someone from accessing their information, especially their electronic health information. And so, and you don't want to be accused of information blocking. We've had whole webinars on on information blocking, but let me tell you the the main keys with this. We used to be able to charge our patients money and clients for their medical records. Okay, those days are gone. You cannot because that's technically could be considered information blocking. All right. And you as a clinician can the law frowns upon that. Okay. So that's number one. Number two, a lot of times the mental health notes were protected because you're ultimately trying to protect your client or patient, right? Because they may read something in the note that they may not understand. And so the second part of this information blocking law is that you have to provide notes to the client unless they are psychotherapy notes. You don't have to provide. Okay. You don't have to provide through information blocking. So if it's a psychotherapy note, don't worry about it. Don't have to provide it. If it's not a psychotherapy note, though, and it's just you're doing a therapy progress note or a group note, that's not considered a psychotherapy note. It's a group note, right? You have to provide those notes to the patient, meaning they can see their group notes. And unless it's an anticipated note or a note that could cause harm. And let me go into and explain that a little bit more. An anticipated note is I anticipate a court case. So as I'm looking at what some of your comments were of things that you have done, like especially if you're dealing with substance use populations, or like someone said, drug court, right? Um, Here's the thing: if it's a note that is an anticipated note, meaning there could be a court case about it. Whether that court case could be a divorce, custody, child court case, it could be a criminal court case. That note doesn't have to be released to that patient. It's an anticipated note. I anticipate that this is going to go to court somehow. So I don't have to share that. Now, if you're doing a group for drug court, look, your notes that, right? Yeah. Okay. You hear me there. So, or is it a note that could cause harm? Now, originally when the law came out, they're like, when they meant harm, they meant like, let's say you have someone in your group and they are in a domestic violence situation with like, let's say they're with their boyfriend and they're very possessive and they have perhaps they have their passwords to their phone, passwords to their email accounts. The patient portal is through the email account. They could get on their patient portal and view notes. So you wouldn't have to share notes to that portal because that they may see those notes. All right. That is a note that may could cause harm. And now they've kind of beefed that out a little bit and said, like, if you think that this note, if you share it, this group therapy note is going to cause the patient or client severe psychological harm, you can hold that note as well. But you don't want to be an information um, blocker. And we're dealing in a day and age that there are so many mandates and rules that come out, and we're legally bound to that it's really hard to keep track of. And at ICANotes, we're here for you for that because we educate you about information blocking, about good faith estimates, all the fun things, right? like things aren't hard enough, but all the things that you have to do, we kind of help educate you about that. Now that we've gotten all the legal stuff out of the way, I want to jump right into starting group therapy notes and how group therapy notes can be fun and not boring. So, I want to give you some fun group therapy titles here. I'm interested if you have any fun group therapy titles that please put them into the chat because I think it's really great for clinicians to share. So, and the group name is really important, and that's you should have fun with your group. And of course, we need consistent names for billing, right? But for the individuals in the group, sometimes these names that you see here are really relatable and they have a true meaning just in the regular old group therapy title, right? So there really can be some fun things here. I actually have a website that has a list of much I just pulled some of their fun ones, but they have a long list of group names. I'm going to put this here in the chat for you so you can kind of look at that if you want to and pick out some of your group names because I think again group titles can be very very helpful. um, Now next we're going to talk about types, topics, and description, so for the groups. Now the group therapy sessions for groups, and yes, Sandra asked a really good question. Will you be sharing this as a PowerPoint? Yes, I absolutely will. I will share my PowerPoint, no problems whatsoever with that. So great questions. Love questions. So now the group therapy session for different types of individuals, and some sessions may be tailored to extremely particular demographics, and other may be more wide. And the therapy types, some examples are cognitive behavioral therapy, client centered. We have psychoeducational, skills development, recreational therapy, occupational therapy. And then you might have the group therapy topics like trauma, is it grief support, is it art therapy, what are we doing? And then you need a description for your group. So when you're doing your notes to get those notes done quickly, you need a description, and that description really needs to go on the top of everyone's group note. Okay. So this is kind of what we talked about. And there's a description for art therapy there, right? You've got a nice description of exactly what that is. Now, we'll talk a little bit more about the group description. It's essential in making clear what the group was about. Like, what type of group was it? Was it a psychoeducational group and we're talking about maladaptive behaviors while we're trying to instill positive behavior changes? Those types of groups follow a highly structured plan and curriculum, and they're usually held in like a horseshoe pattern or a circle configuration where the clinician is the focus and they're acting as an educator? Or is it like a cognitive behavioral group where with cognitive behavioral groups, they can lead to changes in patients' learned behaviors through modifications of their beliefs and and their perceptions, right? And so these groups can change patients' perceptions of themselves, and they can turn negative thoughts of being maybe different and unfortunately unlovable into more positive thoughts. And this change in the thought process can be extremely freeing to patients as they learn to live with the issues rather than being ruled by them, right? And the content discussed in these groups is going to vary greatly, right? So the clinician should really, or provider should focus on beliefs, coping skills, thought processes, or behaviors based on the needs of the patients. And that orientation of that particular room is usually a circle, more of a circle, because they say, well, the horseshoe orientation can interfere with the cohesiveness of the group, right? So you have the different types of groups, what's the description, and even where people sit is important in these types of groups. So, when you're documenting these types of groups, it's okay to have templates that are formed around your group that can be placed at the beginning of the note. What you're seeing here is ICANotes and some of our templates there. And as you grow your practice and you're creating multiple templates that are specific to your group, they can be added and removed from the group as this proceeds. And this is really going to speed up the documentation process for you. Okay. So having that description of what the group is. Now, what you also need to include in the description is the topic, right? What are we talking about in this particular group? Um, that we encourage interaction and what was the focus of the clinician in the group. So, and there's an example there of grief support. So what the topic is, what the group was encouraged to do, they're encouraged to interact, that share strategies of coping with loss, and some of the ways that the group members reacted to each other, right? How did they react to each other? So that's really important in putting that in the description part. Now, also in the description part, there's a few things that are important. Like if it's a group, you can mention the number of members in the group. This often helps jog your memory. That can be helpful if there's liability issues, or that can also be tied to specific reimbursement or payers that have group limits, right? So, um, if it's a family group that you're doing, and I noticed we had several participants in here that were working with family groups, you want to list all the family members that are present on that group note, who was there. And the leader interventions, I think, are really important, as you see that second one, because it talks about what you did for people in the group? Did you involve everyone in the group? Did you keep the group focused? Clinicians always support and structure the group, always support and structure groups. But there's things that you often do, but you just don't document. Like you also set limits in the group, right? You set limits and boundaries. And putting these interventions in really describes and highlights what your role is as a group leader. And some of these you have to consistently do every single group, right? Depending on the type of group that you're working with. So going and having ahead and having that nice description about the leader interventions, and then what's your plan? Now, here's the great thing about plans. If it's a plan for the entire group, it can be as simple as we're going to continue groups with the current group individuals, or it could be something like we're going to further skill development, or we're going to continue to encourage anticipation. These are plans that you want everybody in the group to participate in. And later on, within the individual comments, you can always bring in individual plans. So, but the key to documenting quickly is going to have the mindset and the plan going into these groups, especially on that initial group description. And it needs to be clear, but not rigid. So if you do deviate slightly, the group note will still encompass the areas that you covered within the group in that description. All right. So description is very, very key on kind of helping you get started to document quickly. The next thing is individual notes. Individual notes. I'd like to hear how many of you put individual notes on each group, and then and how many of you don't? And you can do that by raising your hand. You don't have to comment, but you could raise your hand. You could private message me. Individual notes are kind of nice because we talk about kind of their appearance. Like, are they calm or are they anxious? Are they freely communicating? Are they guarded? Their participation. Did they stay for the entire group or did they get up and leave early? Or were they active and engaged? And their behavior was the client irritable and resistant during group, or were they sharing and supportive? And then your verbal communication, what did the client discuss during group? Like, what did they talk about? Did they talk about relationship issues or problems at work? And then, most importantly, what is your plan and progress going to be for that individual client? So let's talk a little bit about treatment plans and groups. At any time, you can stop and ask questions. Happy to answer those. Um, Treatment plans in group, interesting. How many of you are using or actually adding your treatment plans into your group notes? And the reason I ask that is there are some states that Medicaid in certain states requires this. Okay, this is a requirement. This is not an option. This is not a nice to have. This is what they actually require. Okay, so now treatment plans. I'm just going to go over treatment plans. I think everyone here knows what they are, but if you don't feel bad. We've got some students in here, so let's talk about that a little bit. The treatment plans are a written document that outlines proposed goals, the plans, and the methods of therapy. And there are different types of goals. So now you could have a process goal, right? A process goal is kind of outlined in the slide, and outcome goals. Those are both there to deal with. Treatment plans really deal with outcomes. So the anatomy of a treatment plan is you have a problem, and then you have a long term goal, and there'll be a few short term goals, and then the client. Um, you're working with a client to help them succeed in that long term goal. So, as a clinician, you're helping them with interventions to succeed in those short term goals to meet that long term goal. And you need to be able to speak to how the session or group contributed to the patient's treatment goals. And generally, what reimbursement wants to know is how's the client doing on their goals? What progress are they making toward their goals? And what are you going to do with that treatment plan? So, yep. So I've got a couple really good comments here. Ms. Kelly says individual notes within the set of group notes. Great. Individual notes within the set of group notes. Perfect. That's the best practice. What you're doing is the best practice. That's fantastic. And then we have to add the plan, and we follow the SOAP note method. Okay. Subjective, objective assessment, and plan. Perfect. Perfect. So that's a great method for groups. So that is absolute great method because you make sure with the SOAP note you have to have the plan in there, right? I think that's the whole basis of SOAP, right? Is to get that plan in there. So definitely. All right, great. Great feedback. Thank you. Great feedback. So we've gone over what we need to have in as far as our description for the whole group, the leader interventions of what you did, individual descriptions of how they did in the group, and then also linking the treatment plan into the note. Let's see. April says, should we link the complete treatment plan to the progress note or just the part of the plan that we worked on to during the session? That's a really good question, April. That's a really good question. I will go through and kind of demonstrate that. I think linking in just what you did in the session is important. And I think that's a really just what you worked on during the session. And the reason why is, and let me tell you, again, one of the unique opportunities I get with my job is to be able to talk to individuals around, really, around the United States, around the world about issues that they have encountered. Maybe a reason that they've come to our EMR is they've encountered issues at other EMRs, or maybe with reimbursement issues. And I did have one person who consistently linked all of the goals, the short-term goals, the entire treatment plan into the patient's note. And they said, well, we went over all of these short-term goals, and there were a lot of short-term goals. There were like 8, which is that's not always needed. Okay, that's a little, you know, it's up to you as a clinician how many you want to do. Usually you have a long-term goal, you have usually 2 to 3 short-term goals, and you have an intervention for each one of those short-term goals. So, but there were like 8 short-term goals with multiple interventions, and that person would link them all into their therapy session. Okay, there's not a group therapy, but just individual therapy session. And they were doing shorter individual therapy sessions, and the Medicaid auditor came back and said there is no way that you had time to cover all of these in your session, and they asked for some payment back. So it's one of those danged if you do, danged if you don't kind of situations. Um, that's a Southern term for it, right? So where the clinician was actually linking all that in, but the auditor said there's no way you could have covered all this in the session. So that I would link the 1 or 2 things that you're working on, right? But great question, great question. So Elizabeth says we do DAP notes and individual and group notes and the plans involved. Yep, DAP is a great one too, right? See, the most important things about SOAP and DAP are really the A and the P, right? It's the assessment and the plan for reimbursement, right? It's the A and the P. And so that's great. That's great. So excellent. Excellent. All right. Let's talk about session conclusion. One thing, this isn't often an area where people struggle with, right? Because you need to give some lead time to ensure that the group doesn't go over. And you've got to discuss recent goals that those participants may have set, as well as the methods that they're achieving those goals in the future, and implementing strategies to accomplish past remaining goals and developing strategies to get those new goals in. So it's important to discuss how to avoid, regression, losing focus, relapsing when they're faced with stressful situations. So you reiterate the most important points discussed in the group, and you give some time for all of that to come out, because you don't want the group to end abruptly. So now, um, I have a very good friend who does multiple group sessions a day. I'm talking like 5 or 6 group sessions a day. And I I was told when they have particularly long-winded individuals that they start wrapping up the group halfway through the group. Halfway through the group. They cover the main basics, and then they start to wrap up halfway during the group. And that sounded abruptly early to me, but I'm wondering, as you're thinking about in your group sessions that you're doing, how do you handle session conclusion? Because that is always something, because you don't want to cut people right off, right? So do you allow 5 minutes, 10 minutes? Do you have a time limit? Is it just the way things are feeling? But I'd love to get feedback on that. And this is not necessarily included in getting your notes done quick, right? That which is what this webinar is about, is getting your notes done very quickly. But we've gone over some other things like the legal aspects. And I think when you have this kind of group of individuals, and as you were sharing where you're from and what you do, when you have a wonderful group of individuals like this, then it's really good to kind of share secrets and kind of help each other, right? And so I'd like to get your feedback on that as well. And you can put it in private or you can put it in public so everyone can see it. But I'd love to get feedback on session conclusion and kind of wrapping those things up. Because now I'm going to go into some more billing and legal stuff, which is not not the fun stuff, right? Um, on the end of the note, we talked about you need your group description, and then what you are doing as a leader, and plan for the group. Then you need your individual comments, regarding your participants. And then you also need your signature, a if you're billing under supervisor, you've got to get that supervisor signature. And we say date of service. And there's a reason I say date of service is because in best world practices, it's great if you can get your group notes done on the day that they're done, right? If you do them while they're being done, while you're in group, that's great. If you do it immediately following the group, that's best practice, right? Because you're fresh, you remember everything that's going on. But date of service is what you have to bill on. So regardless of when the note is done, date of service is what you're billing on. So that has to be there. There also has to be start and stop times of the group. So depending on who your reimburser is, they could request total time as well. So you've got to say, I was in the group for 60 minutes. We started at 2 p.m. We ended at 3 p.m. Right. So your ICD-10 codes or your DSM-5 codes have to be on there, and then your CPT codes. Now, how many of you are here build managed care plans for a group, therapy services or Medicaid? And you don't have to put that in the public chat. You can do private. We're going to talk a little bit about codes, right? A little bit about codes. So there are two codes that are most familiar for group psychotherapy is a 90849 and a 90853. Now, I saw some of you said you were dealing with like family therapies, and that the multifamily is the 90849, and general therapy is a 90853. And then, how many of you use an interactive complexity code? The interactive complexity code of 90785 during your groups. And see, every insurance plan is different. So as a clinician, they may want to be paid. You want to be paid for the work you do, but like 90849 is generally not covered by Medicare, right? It's not. So, and the 90849, someone's asking to repeat, it's 90849 is multifamily. So, so I have a list of codes here, CPT codes, because I think visuals are really important as far as these are the list of CPT codes. Let's see, Carrie has a good question. Do start and stop times include times for writing notes, like an individual session billing hour, like a 50-minute session and a 10-minute note session? So that, I think that the the time spent with a patient and or family and the time for each code could be pretty specific, like the 30, the 45, the 60 minutes in your psychotherapy. And that coding manual allows for some flexibility in there. Okay. That when you're doing individual psychotherapy, there is some flexibility in that. Now, generally, if you're billing for a group for a certain period of time, um, they will give you, because in reality, if you're writing a note for a particular client, it may take only a few minutes, but if you're writing notes for group therapy, it is a much longer period of time, right? You're not going to be able to, unless you use ICANotes, you're not 10 minutes is really pushing limits for getting your notes done, right? So it really is pushing limits. So yeah, Michelle answered it really good. I was kind of moving around and saying, well, but most insurance companies require at least 53 minutes for the group, and they don't pay for the note writing. Yeah, yeah. So very very good answer on that. So how I don't think anybody here bills. And what I'm hearing is CPT codes for interactive complexity because you hear of that more for when you're doing individual sessions, right? So um and add-on codes, they've always got to be reported in conjunction with an appropriate primary service code. You can never use this as a standalone code, right? So now there are times that you can use it. Like an example is if you have a patient that's really or client that's really uncooperative, is disagreeing with the treatment plan, um, and they, and that planned therapeutic work with them in the group cannot continue, meaning that may be their last time in group. You may have the ability to bill for that. So if there are, what's interesting about interactive complexity codes is if caregivers' emotions or behaviors could interfere with the caregiver's understanding and ability to assist in the implementation of the treatment plan, you could bill for that code, but it can't be used in a family session. It can be used in one of your regular sessions, like if a pediatric patient and the mother attend the session together and the mother is highly agitated and disagrees with portions of your treatment plan or the proposed treatment plan. So, now, we talked about in the beginning confidentiality in group and you letting individuals know when confidentiality is no longer in play. One of those, like if they have asked for a written release, you're sending that information over, right? If they have admitted to abuse of an elder or a child, right? That is called evidence or disclosure of a sentinel event, and that is mandated to be reported to a third party, like generally a state. And so you could bill, if that came out in group, you could technically bill an interactive complexity code on that if that comes out in group. So there are four reasons of billing that interactive complexity code. The other one is if you have to use equipment or physical devices to communicate with a patient to overcome barriers to therapeutic or diagnostic interactions. Now, here's the thing. A lot of people will say, oh, so you mean if I have a translator? If I need to use a translator with a patient, then I can bill that interactive complexity code. No, no. It would more be like if you were dealing with, and we saw someone here, it was from occupational therapy, doing occupational therapy groups. Like if you have a patient with ALS that loses the capacity for communication, for expressive communication, and they require some assistive technological support devices to continue treatment. So that would be an area that you could do. You could bill on that interactive complexity code. So, all right. So we have gone over a lot today. There have been a lot. We went over writing notes quickly, utilizing kind of templates, how your notes should be written, and how to get reimbursed for the work you do, right? Getting reimbursed for that work that you do, being able to add on those particular codes. I am interested to see if anyone has ever added on that interactive complexity code. So, has anyone ever used those in the group level settings? And did you know you could use them? A lot of times people, were unaware because insurance is not out there saying, hey, you can charge us more. They're not waving a flag to let you know that. So I've got things in private, so that's good. That's good. All right, I am not. What I'm going to do is I'm now going to show you group therapies in ICANotes and how to actually to do them in ICANotes. Now we talked about if you're writing notes on paper, okay, then those templates are really nice to have, right? They're really really nice to have. I would change up what they say though, because now some auditors from certain insurance companies are using plagiarism checkers. Like when you're in school and you wrote a paper and you turn it in and they run it through a plagiarism checker to make sure that didn't say the same thing. They're doing that with notes now. And at ICANotes, we're committed to constantly changing notes to make sure that this doesn't happen. And we haven't had this happen. Um, but just be aware of that when you're doing your own templates as well, that you're going to want to change that verbiage. Okay, you're going to want to change that verbiage. So let me show you a little bit how therapy groups work in ICANotes. If I go into ICANotes and I select a group, and as you can see, I have lots of groups I can select from, but I'm going to go in and I'm going to grab group therapy. I can look at previous sessions, see what was done in those sessions, who the individuals were there, and I can create a new session. So I'm going to create a new session. We talked about service codes, so billing under specific service codes, billing under certain your supervisors, being able to bill under them, and then also making sure the date of service is on the note. Okay, the date of service. So let's say this was actually done on the 26th. Making sure that encounter date or date of service is there. The note title is there, so I could say group therapy, the best ever. And then I could go in and drop my service codes in. At the end of the notes, I'll have the ability to one time put that on everybody's notes. So my start and end time and my total time. And so just by doing that, it grabs all my group members here, lines them up, and then we talked about putting a descriptive text on everybody's note, right? So go ahead, we'll stick that right in. And then I can pick the therapy type. Now, just for fun, I'm going to go in and I'm going to say maybe I'm just going to say it's client centered. Okay. And then the group therapy type, remember that's the next thing we're going for. I could say perhaps this is a focus group and we're dealing with self-esteem today. Okay, so I could go in and pick that. I could pick who is present today. So at the session, and I'm going to say it's a group, and then I have my group members. Maybe there are 10 members here, maybe there are 20. It really depends. And then I can go in and talk about leader interventions. So I'm going to go in, I'm going to talk about my leader interventions and what I did for the individuals. And I'm going to say that I kept the group focused. I involved everyone in the group. I facilitated discussion on perhaps some coping skills or building self-esteem. And I offered support and structure. And then I gave limits and boundaries. Okay. Some people like facilitated the group process. Really, that's kind of a generic term people have used, but they used it for a long time. And then I can put in my plan. All right. So there's my plan. Maybe we're just going to continue groups. Okay. Or maybe increase participation. This plan is for everyone in the group. Okay. Everyone in the group. Now, this part goes on everybody's note. And as you can see, I can format that however I want it. I can also add my own templates in. So if you have certain templates, you can go ahead and throw your own templates into our create remarks button. So I can go in here and I can say like I love chocolate. Okay, I love chocolate, like an unhealthy obsession with chocolate. So I could go in. Let's pretend I'm going to grab my Wikipedia here. Pretending this is a group that I've done a template on chocolate. I'll go ahead and pull that over, and then I'll just create the remarks button, and I'll say that this is October's group. And I could actually add my template in here for chocolate from Wikipedia, just cutting and pasting right there. And I could highlight that button, and then that could then be my chocolate, October's group chocolate. And so I could literally put that template in here. So you have the ability to put your templates in, and it drops the chocolate template right in there. I didn't realize there's some bad things about chocolate when just pulled that over there, but you can do that. And then when I talked about changing up your template, that's what we do in ICANotes. We change the verbiage. But see, when you have the ability to create your own templates in here as well, you can create multiple variations of them that are completely randomized. And so they will come out. You don't have any control because it's randomized. You push the button, variation 3 may come out, variation 1 may come out, variation 2 may come out. All right, so that's one of the nice ways. If you want to get your own templates in here, you can. So very quickly, I've got this description of the group, who was present, leader interventions, plan. This goes on everyone's note. And then I can go in and I can make comments on how people are doing. Now, let's say that Sheldon Cooper was in my group and he was pretty resistant in the group today. So I can go in on my individual remarks and I'm going to talk about like his participation. So he monopolized and was intrusive during the group today. Okay. And his behavior was he was resistant and he had poor insight and he was disruptive to my group today. And so, and I can just say, that is unfortunately what happened with Mr. Sheldon. And then I can link in his treatment plan and it will pull up his treatment plan. And there are my short term goals. There are my interventions here. And we have interventions for everyone: occupational therapists, recreational therapists, peer support, therapist counselors, nursing, everyone. So I can pick what we're working on with him. And so maybe for him, we were working on that he will replace negative and self defeating talk. I can link that in. Oh, I have to grab it to link it in. So let me select none, select here, link the intervention, links it in. So he so he's gonna with verbalization of realistic positive cognitive messages, and we're gonna provide therapy and support to reinforce those positive reality-based cognitive messages that will enhance his self-confidence. And he's not doing good on that today. Unfortunately, there have been no apparent progress in meeting these goals, and we need to continue the current plan and we need more time. Okay. We need more time for this intervention to work for this client today because he had a disruptive day during group. And then that will go into Sheldon's note. So there's Sheldon's note. Now let's pretend Bugs Bunny was an angel during group. He did great. He did great. He was so good during group. His participation is that he was active and engaged during group. You know, we say that he had good comprehension and he stayed the entire session, and his behavior is that he was sharing and supportive, and he did wonderful during group today. He was attentive, and his verbal content is he talked about maybe some relationship issues. Okay. And so we could say if he was not, not suicidal, not homicidal today, and he convincingly denied homicidal ideation, and we could link that treatment plan in. So really quickly, and as if you're doing this really quickly, I can go through and say Test Friday had a good day. Again, they stayed the entire session, they were active and engaged, and their behavior was a normal during group. So it was appropriate, and their verbal content was maybe on some depression that's going on. And then again, not suicidal. All right. And that is how you can get your group notes done very, very quickly, because all I have to do is go through. I can see easily who I have and have not created notes on, and then I would simply compile my note using the plus button. So simply compile my note and my note is done, but I can easily see who I haven't charted on. So Lola Bunny, didn't chart on her. I need to go in, she was normal and appropriate, active and engaged, and her behavior was that she was attentive. Undone. Okay. And so on. And so this is honestly, this is an easy way as well to get your group notes done in about a minute. In about a minute. Now, if you're using paper, again, templates are great. I would change my templates up. And I would come to an electronic medical record. Because one, it'll be easier for you to actually to do your notes, But let's see. Okay, so we're just reviewing some of the comments here, the private comments. So, any thoughts about this way of doing group notes? Any thoughts about this way of getting group notes done? And I do want to answer the question. Yes, this is being recorded. You will get this recording later on. So, and we will send this out to you. Probably have it out to you today. We do have some handouts that I want to share those. One is that group confidentiality agreement that is important. I think that's a really great thing to have. And then we also have the group therapy. We have that checklist. Okay, so we have it in PDF format. So it is a group therapy checklist that we have in PDF format. And if you grab that, that will go over exactly what you need as far as kind of a breakdown of what you need. And so please make sure you get those handouts. So because if you're like, well, I'm using paper, I want to stick on paper, that checklist will kind of help you literally tick the boxes as you go down. And so I'm going to grab that checklist so I can show it to everybody, because so you can kind of see what you're getting here. Let me just pull this right up for you. And it is in PDF format. I'm going to be showing you in Word format, but it is in PDF. PDF is always a little bit prettier. Um, and so this is that group therapy checklist. So you can literally go through, again, client demographics, group title name, therapy type, group therapy topic, comprehensive descriptive summary, group number, leader, appearance, participation, behavior, verbal communication, plan and progress, and then follow up. Follow up's really important as well. We didn't, we kind of dipped down onto that. And then also the legal aspects of the note: your name, your credentials, your signature, your date, supervisor signature, and the billing elements: the date of service, the provider number, the location, procedure code, modifiers if you need them, most importantly, start and stop times of the groups, and then ICD-10 diagnosis code along with the CPT code. So, all right. Let's see. Yes, you will still get a recording. Sandy's in here, very informative. Thank you guys so much for your feedback. I really, really appreciate you. Um, and we said it's time efficient, takes stress of finding accurate terms. Yes, that's one of the really nice things I think, is that a lot of times you're sitting down, you're trying to write the note, and you know what you want to say, but it just doesn't always get typed out or come out on the paper. So that is one thing ICANotes definitely helps you with, is finding the verbiage. So. Well, thank you guys so much for your time. I really, really, really appreciate you. And thank you so much for coming in and participating in the webinar. I love when people participate and share. I think that there's just such a large wealth of knowledge of individuals in here today. And so sharing and kind of talking about the way that you do things is so helpful. So thank you guys so much. Really appreciate y'all. And I hope y'all have a wonderful, wonderful day. All right. Thank y'all. Take care. Bye bye.